Welcome everyone, my name's Shanae and I work at the Northwestern Melbourne Primary Health Network, and this is Melissa who works at Southeastern Melbourne Primary Health Network, and our roles are about supporting aged care in the after hours period. We'd like to acknowledge the traditional owners of the lands on which we're meeting and working. For me, it's the Wurundjeri Wurrung people of the Kulin Nation, and I'd like to pay my respect to elders past and present everywhere, and also extend that respect to any Aboriginal and Torres Strait Islander here with us today.
Thank you, Shanae. Now, for those of you who are not familiar with primary health networks, or the abbreviation we commonly use, PHNs, PHNs were established in 2016 by the federal government with the purpose of streamlining access to health services, particularly for those at risk of poor health outcomes. Nationally, there are 31 PHNs, with 3 in Metro Melbourne and another 3 in regional Victoria. Traditionally, our core scope of work has been in primary care, linking GP practices to services within our catchments. But recently, as a response to the findings of the Royal Commission into Aged Care Quality and Safety, we've been commissioned to deliver programs into the aged care space. Currently, we have 2 programs that are directly related to residential aged care homes. The first is enhancing access to telehealth services, and the second is the one we are here to discuss today, which is to increase awareness about services that are available to assist you with a deteriorating patient in the after hours, with a focus on improving overall after hours capabilities and help reduce hospital presentations for residents by providing the right care at the right time in the right place.
Thanks, Melissa. For a little bit more information about the after hours program specifically, PHNs received funding to support the Australian Government's response to the Royal Commission into Aged Care Quality and Safety. And a key objective for PHNs was to bring greater awareness to residential aged care settings about after hours services provided by general practitioners and also other health professionals, and improve overall after hours capabilities to help reduce unnecessary hospital presentations among residents after hours. So Northwestern Melbourne Primary Health Network and Southeastern Melbourne Primary Health Network have developed what we're calling the After Hours Toolkit. This comprises of 5 key resources to support nurses in the after hours period. These are intended to better prepare nurses and staff to help identify which after hour service is best, depending on the nature of the incident. This is the Toolkit guide, and this is a step-by-step explanation of the toolkit components, where to find them and how to use them.
Thanks, Shanae. So now I will go through and give you some more information about the 5 tools within the toolkit. The first one is the After Hours Action Planning Audit Tool. And this is to enable aged care homes to self-assess their current after-hours preparedness, identify gaps in after-hours capabilities, and identify which resources, processes, and procedures could be adopted to improve access to appropriate medical care for residents. Use this to assess the status of your home's after hours preparedness, and it does contain links to other helpful resources to help strengthen any gaps that you may identify. It is available as a downloadable version, or you can print it from our web pages as well. Recommendations for implementing this is to do it at 2 levels. It can be done at management level, but we also encourage you to get your staff to complete this as well, particularly the night staff. It could also be used to included in onboarding of new staff, as well as annual competency reviews.
The next tool is the Medical Support Checklist. This tool is based on the ISPA communication tool to aid staff when a resident is unwell and support is required. To use it, you simply complete the form and contact any service where you need to provide information on a patient's condition. This might be the GP, a locum service, or VVED. For more information on examples of types of low to medium acuity conditions referred to in this resource in the recommendation section, you can visit the Medical Referral Options for Residents in Aged Care Homes link that's provided on our webpage. This tool is provided in a notepad format, A4 or A5, and we recommend that you store this at your nursing stations and complete in hard copy prior to phoning for support. You can also use this tool in a downloadable PDF, which is available on our webpage.
Thanks, Sinead. So the next tool is a family fact sheet. And this is a fact sheet that informs family members and carers of what happens if someone falls ill at night or on the weekend and what families can do to help. This fact sheet is also available in 9 languages other than in English and are available to download from our web pages. And recommendations for implementing this tool is to include it in admission packs and also give it to medical treatment decision makers in families of residents without cognitive decision making capacity. You could also present it at monthly family and resident meetings and consider having printed copies available in common areas.
Thanks, Melissa. The next tool is the Person-Centred After Hours Action Plan. This is a one-pager and enables staff to summarise key information explaining a resident's after-hours care plans for quick and simple reference during an emergency. The plan should be placed where staff can easily access it at all times, while also respecting the resident's right to privacy, and it should be regularly reviewed and updated. So recommendations for implementation of this tool is that you might get a nurse to complete one of these per day for the resident of the day, so that it's not an onerous task to complete one for every resident in your home when you first get access to the tool. It's available as a fillable, downloadable PDF from both Sempton and Northwest Melbourne PHN's web pages, and we recommend you store this with advanced care plans and other specialty documents as well.
Thanks, Sinead. So the last tool within our toolkit is the service directory. This comes in 2 parts. Part 1 is an editable template to list locum services and which GPs use which service. There's also an after hours pharmacy section that you can populate with any after hours pharmacy arrangements that you may have. Part 2 is what we're referring to as a static list, and these are available on our web pages for you to download that includes local services that you can access in the after hours. This here is the South East Melbourne PHN web page, and you can download a service directory relevant to your area, whether you're in the Alfred, Monash or Peninsula Health catchments. The Northwest Melbourne Primary Health Network have their static list available on their webpage as well, and they have all the various services listed here and how to contact them, and all the different residential inReach contact details as well are all sitting there. So that's our service directory. Just also wanted to let you know that we do have some education modules that are in development at the moment. There are going to be 18 topics to help educate you with early recognition of a deteriorating patient. These modules are referred to as BERTI, which is for Better Lives for Residents Through Innovative Education. Once these modules are available, we will pass on details to you about how you can access them.
Thanks, Melissa. Thanks everyone for listening today, and we recommend that you engage with the resources and tools that we've explained. And if you need more information or want to discuss them further, you can contact Melissa or I through the details provided on the screen. Thank you. Okay.